Hey everyone, I'm really excited about today's deep dive because we're going to be talking about something that I know a lot of you are interested in, and that is AI in healthcare. And specifically, we're going to be looking at an article called AI-Powered Assistance, Transforming Healthcare Training and Support, Exploring the Possibilities.
Okay.
And this article really got me thinking about how AI could help with training and support, especially when it comes to those, often complicated EPR systems.
Right.
So for those of you who might not be familiar with EPR systems, EPR stands for Electronic Patient Records.
Yes.
And these are basically, digital records that contain all of a patient's medical information.
Right.
And they can be pretty complex to use. So I think there's a lot of potential for AI to step in and make things a little bit easier.
Absolutely. And, one of the things that I find really exciting about AI assistants is how they can help new staff members, especially those who are just starting out in their careers.
Like a new nurse on their first day.
Exactly. Imagine a new nurse on their first day. They're already feeling a bit overwhelmed, right?
Oh, yeah.
And then they have to learn how to use this complex EPR system.
Oh, yeah.
It can be a lot to handle.
Yeah.
But what if they had an AI assistant that could guide them through the process?
That would be amazing.
Right. It would be like having a seasoned colleague right there by their side, ready to answer any questions they have and help them find the information they need.
And it's not just about giving them the answers though, right?
No, not at all. It's about empowering them to learn the system independently.
Yeah.
So they can become more confident and efficient in their roles.
So they can focus on what really matters, which is patient care.
Exactly. And the article we're looking at today actually highlights a platform called HeyGen that's doing some really interesting work in this area.
Oh, I've heard of HeyGen.
Have you?
Yeah.
Yeah.
Yeah, they're the ones who are creating those lifelike digital avatars, right?
Yes. And those avatars can be customized to actually look like familiar faces from the NHS.
That's so cool.
Yeah, so imagine you're a new nurse and you're being trained by a digital avatar that looks like your ward manager or a doctor you admire. It could really help build trust and make the training feel more personal.
That's a great point. I think that visual element could be really powerful, especially for someone who's new to the environment.
Absolutely.
Yeah.
And it's not just about looks either. These avatars are powered by AI, so they can actually answer questions, provide guidance, and even adapt to the learner's individual needs.
Wow, so it's like having a personalized tutor.
Exactly. And the article mentions that these avatars can be programmed with the specific knowledge base of the healthcare provider.
Oh, that's interesting.
So the guidance they provide is tailored to the actual protocols and procedures used at that particular hospital.
So it's not just generic advice, it's specific to their workplace.
Exactly. And that's where natural language processing, or NLP, comes in.
Okay, now you're going to have to explain that one to me, because I'm not exactly a tech whiz.
Sure, no problem.
Yeah.
So NLP basically allows the AI assistant to understand and respond to human language.
Oh.
So imagine you're a healthcare assistant, and you need to find information about a specific procedure.
Okay.
Instead of having to navigate through a bunch of menus or search for keywords, you can simply ask the AI assistant in plain English.
And it understands what you're saying.
Exactly.
Oh.
And it can pull up the relevant information from the hospital's database.
That would be so much faster and easier than the way we do things now.
Exactly. And it frees up healthcare professionals to focus on what they do best, which is caring for patients.
I'm really liking where this is going. Now, the article also mentions something about HeyGen's commitment to accessibility.
Yes, that's another thing I find impressive about their platform.
Can you tell us a little bit more about that?
Sure. So they've included features like closed captions, adjustable text sizes, and even voice modulation.
Okay.
This means that staff members with visual impairments, learning differences, or even just different preferences can all access the information they need in a way that works for them.
That's fantastic. So they've really thought about making this AI assistant as inclusive as possible.
Absolutely. They want to make sure that everyone can benefit from this technology.
Now, have there been any real-world examples of HeyGen being used in the NHS yet?
That's a good question.
Yeah.
And to be honest, the article didn't mention any specific case studies within the NHS just yet.
Oh, okay.
But that doesn't mean that it's not happening or that it won't happen in the near future.
Right.
Because, the potential is definitely there.
Yeah, and even though we don't have NHS-specific examples, there's already a lot of evidence from other healthcare settings that using AI assistants for training can be really effective.
Oh, absolutely.
Yep.
We're seeing nurses and doctors picking things up faster, retaining information better, and feeling more confident in their roles.
So it seems like the evidence is pretty strong.
It is. And when you think about the sheer scale of the NHS, a platform like HeyGen could make a huge difference.
Yeah, it could really help to standardize training and make sure that everyone is up to speed on the latest procedures and protocols.
Right. And their ability to handle a large number of users while still meeting those strict data security requirements is really important.
Yeah, data privacy and security are obviously huge concerns in healthcare.
Absolutely. It's non-negotiable. Any AI platform used in the NHS has to meet those stringent data protection regulations.
So we're talking about things like end-to-end encryption, anonymization, all of that.
Exactly. Every measure possible to safeguard patient information.
Okay, so it sounds like HeyGen has the potential to be a really valuable tool for the NHS.
I think so too.
But let's shift gears a bit and think about the bigger picture here.
Okay.
Because data privacy is just one piece of the puzzle, right?
Right.
There are a lot of other things to consider when implementing AI assistance in healthcare.
Absolutely. For example, user adoption is a huge one.
Yeah, you can have the most sophisticated AI assistant in the world.
Mm-hmm.
But if staff don't feel comfortable using it, it's not going to be very helpful.
Exactly. So we need to think about how to encourage buy-in from staff.
And how do we do that?
Well, for starters, the training itself needs to be engaging and easy to digest.
Right. No one wants to sit through a long, boring lecture about AI.
No, definitely not. We need to make it fun and interactive.
So maybe things like bite-sized modules, simulations, even gamification could be helpful.
Exactly. And remember those lifelike avatars we talked about?
Yeah.
They could be a great way to make the training more engaging.
Oh, for sure. Especially if the avatar looks like someone you know and respect.
Exactly. It could feel more like a mentorship than a training session.
And it's also important to show staff the real-world benefits of using these AI assistants.
Absolutely. We need to highlight success stories and demonstrate how these tools can make their lives easier and improve patient care.
So things like case studies, testimonials, maybe even pilot programs where staff can try out the AI assistant in a real-world setting.
Exactly. The more we can show staff how these tools can actually help them, the more likely they are to embrace them.
And I think clear communication throughout the process is also essential.
Oh, absolutely. Staff need to understand why this technology is being implemented, how it works, and what benefits they can expect to see.
Transparency is key.
It is,
Yeah.
and it helps to build trust and make sure that everyone feels like they're part of the process.
Now, while all of this sounds great in theory, we also have to consider the practical side of things.
Right.
Integrating these AI assistants with existing EPR systems can't be easy.
You're right, it's rarely a plug-and-play situation.
So how does HeyGen handle those integration hurdles?
Well, the article mentioned that they offer an API and support services to help with the process.
Okay.
And in some cases, it might even require something called middleware, which basically acts as a translator between different systems.
So it sounds like they've considered the complexities and are offering solutions to make the integration as seamless as possible.
Exactly. They're not just focused on the flashy avatars, they're also thinking about the behind-the-scenes work that needs to be done.
And that's really important because at the end of the day, it's all about making sure that these AI assistants can actually be used effectively in a real-world setting.
Absolutely. It's about the whole package.
Well, I don't know about you, but I'm already seeing the possibilities here.
Me too. This is really exciting stuff.
This has been super insightful so far, but let's continue our deep dive into the world of AI-powered assistants after a quick word from our sponsors.
Sounds good. Welcome back. It's great to be continuing this discussion.
Yeah.
And as we were saying before the break, AI assistants have this incredible potential to really shake things up when it comes to healthcare training.
Yeah, and we were talking about HeyGen specifically.
Right. HeyGen, they're really pushing the boundaries with those lifelike avatars and that personalized approach to training.
Exactly. It's not just about making training more efficient, though.
No, it's definitely not about just ticking boxes. It's about making sure healthcare professionals feel empowered and confident in their roles.
So they can provide the best possible care to their patients.
Exactly. Think about it. If a doctor has all the information they need right at their fingertips, if they can access the latest research or double-check a protocol in seconds because their AI assistant is so good, it frees them up to focus on what really matters, the patient sitting right there in front of them.
It's about removing those barriers and distractions so they can be more present and attentive.
Absolutely. It's about giving them the tools to do their jobs to the best of their abilities.
Now, we talked a lot about the tech behind these AI assistants.
We did.
But as we've been saying, the technology is only part of the story.
Right.
We need to make sure that staff actually embrace these AI assistants, that they see them as valuable tools and not just another burden.
Yeah, user adoption is key.
Yeah.
And I think one of the biggest mistakes we often make with new technology is we forget about the human element.
Right. We get so excited about the bells and whistles, we forget that people need to be trained and supported to use it effectively.
Exactly. And the training itself needs to be engaging, it needs to be relevant, it needs to be user-friendly.
Yeah. No more of those dry, boring training manuals.
No, definitely not. We need to think outside the box a bit.
Like we were saying before, bite-sized modules, interactive simulations, maybe even some gamification to make it a little bit more fun.
Absolutely. And those lifelike avatars we talked about could play a huge role here.
Oh, for sure.
Imagine a training program where you're guided by a digital avatar that looks and sounds like a colleague you respect.
That would make a huge difference, especially for visual learners.
Right. It makes the training more relatable, more human.
And it's not just about the training itself, right?
Yeah.
We need to show staff how these AI assistants are already making a difference in the real world.
Absolutely. Showcasing real success stories, testimonials from colleagues who are already using these tools and seeing the benefits.
That word of mouth can be so powerful.
You can. And pilot programs can be a great way to let staff test drive the technology in a controlled environment.
Yeah, like a beta test almost.
Exactly.
Yeah.
You get valuable feedback from early adopters. You can iron out any kinks before rolling it out to the entire hospital.
And it gives staff a chance to get hands-on experience, to see how the AI assistant can actually help them in their day-to-day work.
And that feeling of ownership, being involved in the process from the beginning, can really boost buy-in.
Okay, so we've talked about training, we've talked about pilot programs, but even with all of that, there's still going to be some resistance to change.
Oh, definitely. Change is hard, especially in a field like healthcare where things have been done a certain way for so long.
So how do we manage that? How do we help staff transition to this new way of working?
I think communication is key.
Yeah.
From the very beginning, hospital leadership needs to be transparent about why they're implementing these AI assistants.
And how they'll benefit both staff and patients.
Absolutely. And that communication needs to be ongoing, not just a one-time announcement.
It's about being open to feedback, addressing concerns, and providing support throughout the process.
Exactly. We need to acknowledge that this is a big change, and some people are going to need more time to adjust than others.
Patience and empathy are essential.
Absolutely. It's about bringing everyone along on this journey.
Because ultimately, we all want the same thing, right?
Yeah.
A healthcare system that's more efficient, more effective, and provides the best possible care to patients.
Absolutely. And I think AI has a huge role to play in achieving that.
Me too. I think we're just scratching the surface of what's possible, and I'm really excited to see how things evolve in the coming years.
Me too. It's an exciting time to be working in healthcare.
So we've talked a lot about HeyGen and how AI can be used for training.
We have.
But AI is being used in so many other areas of healthcare as well.
Oh, absolutely. The possibilities are endless.
Let's zoom out a bit and look at the bigger picture. What are some other areas where AI is making a real difference?
Well, one area that's particularly exciting is diagnostics.
Oh, yeah, I've heard a lot about that.
We're seeing incredible advancements in AI algorithms that can analyze medical images like X-rays, CT scans, and MRIs with remarkable accuracy.
So we're talking about AI potentially helping doctors to make diagnoses.
Exactly. In some cases, these algorithms can even detect subtle patterns that might be missed by the human eye.
Wow, so that could lead to earlier and more accurate diagnoses.
Exactly. And that can make a huge difference in terms of treatment and outcomes.
But are these AI diagnostic tools meant to replace doctors?
That's a question that comes up a lot. And it's important to emphasize that AI is not about replacing human expertise.
Okay, good.
It's about augmenting it.
So it's more like AI and doctors working together, almost like a team, right?
Exactly. Think of AI as a really powerful tool that doctors can use to enhance their own skills and knowledge.
So it's not about replacing doctors, it's about supporting them.
Exactly. And ultimately, that benefits the patient.
Makes sense. Now, are there any other areas in healthcare where AI is, making a big impact?
Oh, absolutely. One area that's showing a lot of promise is personalized medicine.
Oh, interesting. Tell me more about that.
Well, you see, AI algorithms can analyze huge amounts of data. Massive amounts of data. And that includes things like a person's genetic information, their lifestyle factors, even their entire medical history.
Wow.
And they use all of that to help create treatment plans that are tailored to each individual patient.
So instead of like a one-size-fits-all approach to medicine, we're moving towards treatments that are specifically designed for each person.
Exactly. And this could really revolutionize how we approach so many different conditions.
That's amazing. It sounds like AI has the potential to touch just about every aspect of healthcare.
It really does.
But with all this talk about AI and algorithms and data, it's easy to lose sight of the fact that healthcare is ultimately about people.
Oh, absolutely. We can't forget about the human side of things.
So how do we make sure that AI is used ethically and responsibly in healthcare?
Well, that's a really important question. And I think the key is to remember that AI should always be a tool that serves humanity.
So it's not about letting AI take over. It's about using AI to enhance our capabilities.
Precisely. We need to ensure that AI is implemented in a way that respects patient privacy, promotes fairness and equity, and ultimately strengthens the relationship between doctors and patients.
Right, because that relationship is at the heart of healthcare.
It is. And while AI can certainly help to improve care, it should never replace those essential human elements like empathy and compassion.
I think that's a great point to end on. As we've discussed today, AI has incredible potential to transform healthcare in so many ways.
It really does.
We've talked about how AI assistants, like those being developed by HeyGen, can revolutionize training and support for healthcare professionals.
And how AI is making waves in diagnostics and personalized medicine.
But it's important to remember that we're still in the early stages of this AI revolution.
We are.
And there's so much more to explore and discover.
Absolutely. It's an exciting time to be a part of this field.
And as we wrap up today's deep dive, we want to leave you with a final thought. As you think about the future of healthcare, ask yourself how AI can be used to make a positive impact in your own world.
Whether you're a doctor, a nurse, an administrator, or even a patient, there's a role for everyone in shaping how AI is used to improve healthcare for all.
Thanks so much for joining us on this deep dive, everyone.
It's been a pleasure.